Hello and welcome to Health Talk. I'm Dr. Manny. Mental illness is something that weighs heavily, not only on the patient, but on the family too. The ups and downs can be frustrating and scary. But what if you don't know what to look out for? Joining me now is journalist and author Sheila Hamilton. She lost her husband to bipolar disorder. Her book is called All the Things We Never Knew: Chasing the Chaos of Mental Illness. Thank you for coming.
Hello, Dr. Manny. It's great to see you.
And such an inspiring book that I think a lot of people, as a OBGYN, I see so many patients that they just don't know how to cope or get help from mental illness. I think it's an epidemic that we see in this country. But getting to your book, 6 weeks after your husband was diagnosed with bipolar disorder,
yes,
he lost his life.
Yes, his doctors believe he compensated for his illness for most of his adult life, that he likely had onset when he was a teenager because he'd reported some depressive episodes. But because he was so intelligent and so high functioning, he managed to deal with his illness until he had a series of traumas. And he wasn't sleeping and he wasn't doing well during those traumas. And he went to a well-meaning physician friend and asked for antidepressants to help him. And the antidepressants pushed him over into a horrible manic state. He had akathisia, which, as you know, is a kind of skin-crawling agitation where he couldn't sleep. He felt like he couldn't stand himself. It began suicidal thoughts. And it really was the beginning of the end for him.
Yeah, and that's the sad thing, because number one, diagnosing bipolar disorder sometimes is a little challenging, and it has to be somebody who really knows how to make the diagnosis. And the treatment of bipolar disorder, just like you said, if you get on the wrong phase of that, up and down manic phase, and you treat it with something that should not be treated with, then you can push the patient over the edge. What was it that you wish you knew before it all happened?
There were so many signs and symptoms that I saw that I just chalked up to David being David. He was a very interesting guy. He was completely full of energy and big ideas, and in his hypomanic state, he was so charismatic and so charming. And then he would go into these depressions. I didn't know they were depressions. I thought it was just him withdrawing, taking care of himself, resting. He would be darker, he would be more irritable, but then he would always swing back to this person that I fell in love with. Right. And what I wish I'd known is that the anxiety and the irritability that I saw on the depressive side were clear signs that he was in need of help.
But a lot of folks just miss the signs of mental illness. They chuck it to, he or she is having a bad day, or they're just getting old and cranky, or whatever the case may be. But as you research your book, what should people know about mental illness when it comes to, what are the sort of the red flags, if you will?
Well, certainly that anxiety that increased, especially as he got more confused. He was disorganized in a way that was very unlike him. He had difficulty completing regular tasks like billing. He became so withdrawn that he didn't enjoy the things that I knew he loved. He loved being with our daughter. He loved going out on walks in nature. And when you begin to see those things happen on a regular basis, it really is time for an evaluation. He had anosognosia and refused to be evaluated by a psychiatrist because he really didn't believe he was sick.
Right.
And I think that caregivers who know our partners need to be the first person looking out for the health of our families.
Right, because sometimes they just don't rationalize
that
they need to get help. One of the things, again, that you mentioned in your book, that there are other things, as you did your research, that could help patients with mental illness, that doesn't have to be a popping pill society.
That's
that
right.
There are other things. Name a few.
Exercise is really big. Mindfulness is huge. I mean, there's studies now that show that mindfulness is as or more effective than antidepressants, especially for people who have repeated depressions. Cognitive behavioral therapy, which teaches us how to deal with the thoughts that we're having. And meditation. It's enormous to be able to actually calm your breath, to take a moment, to learn to actually recognize your thoughts as thoughts. Right. Many people will say, I'm going crazy. Well, it's actually, I'm having the thought that I'm going crazy.
Right. Resources. There are several that you list in your books. In your book, what are some of the resources you found helpful?
I've had tremendous help from the Foundation for Excellence in Mental Health Care. It's helping psychiatrists and scientists all over the world be able to find a place that's actually challenging some of the pharmaceutical industry's assessment of what we should do with mental health. It's helpful for families, especially who want to step down their loved ones from 12 and 13 medications. I've also I've compiled a bunch of resources on my website at SheilaHamilton.com with experts from all over the mental health field, and you'll be able to get a lot of resources there.
All right. Well, listen, this is a very good book. All the things we never knew. Everybody should get it.
We need to provide some hope for people who are dealing with mental illness. The way that the system has been run is to say you're going to be on this lifetime of disability. It is not true. Recovery is possible.
Absolutely.
And I've got the resources that can help.
All right. Well, thank you so much. Thank you very much for coming. And if you have any health questions, send them here at Fox at Dr. Manny at foxnews.com. Until next time, I'm Dr. Manny.